Welcome, everyone. My name is Dr. Charysse Nunez, and I'm going to be hosting and facilitating today's Crisis Jam. Our feature presentation will be with Charysse Nunez from the Ad Council, talking about some new work that they're beginning to launch around the state of mental health and their multi-year mental health initiative, and some data that they are using to understand the segmentation of mental health in the population, which will inform the development of that initiative. So super excited to hear that. Just so everyone's aware, I'm on the tail end of a cold, so I'm going to try to mute myself if I start coughing, but bear with me if I'm a little bit slow today. Okay, next slide, please. This is always one of my favorite slides. It's really exciting to see just the level of participation from various organizations who are in this. We also know that we have tons of individual folks participating, and from internationally all over the US. And here you can also see some of the 5 most watched Crisis Jams, both the number of people on the Zoom as well as on YouTube. So if you didn't catch those, you can always catch up and see some of what other folks in the field are watching. And then if you're having issues and this Crisis Jam has disappeared from your calendar, Karen just very helpfully put the link in the chat. And so you should be able to download a fresh Outlook calendar series here. You can also get it on the website. And then if you're having real trouble, reach out to Karen. She can always help you. The talk.crisisnow.com website, as always, has the link for the Zoom. It tells you what's coming up. You can get the t-shirts that we were talking about or other promotional materials. And as you scroll, you'll see materials from previous sessions as well, so that you can rewatch them or share them with your friends and colleagues, as well as lots of other really fantastic resources to help think about improving crisis systems. And you can see those here, some of those articles. Now, some of the things we wanted to highlight about crisis in the news, this was a really fantastic article that came out recently in The Guardian, really talking about the question of what is the relationship between TikTok and mental health. And according to this article, about 6 in 10 teenagers are daily users of TikTok. And TikTok in general, as for those of you who are not familiar with the social media space, has been shaping how all of social media looks, even Instagram. So there's this real question of what is the impact of TikTok on mental health, particularly youth mental health, and particularly as we think more about the questions of social connectedness and the importance of real relationships amongst people and how that's protective mental health, and what does social media and TikTok do, either positive or negative or in between for mental health. So this article really asks that question and talks about the fact that we know very little really about that. And then simultaneously, TikTok actually came out with a number of resources and tools around mental health. And so you can look at what some of those resources are at this article. And I think Karen's also going to put that in the chat as well. So this quote from the Ad Council is something that I really love, and we'll hear more about this work, but I'll read it for a moment. So we're at a tipping point. The federal government and many other organizations across the US have made mental health a priority and are addressing the numerous systemic challenges that exist. And now we must collectively change the way we, as a country, view mental health. I think that speaks to 2 things that I've been feeling really acutely in my own, for myself as I do this work, both that this is a real moment where there's such need, such pain, so much challenge that we're all facing, but it's also this really beautiful moment of opportunity and investment in mental health. And so for me, it's been one of the most exciting times to be doing this work and to think that there's a moment in our country and our world where we can make a big difference. And that quote spoke to me because it felt like it was validating that response. So I just really love seeing this quote. So thank you for choosing that David and team, and thanks to the Ad Council for loading it. So we've talked about these t-shirts a lot. If you want one, volunteer for the trivia hot seat, reach out to Karen. Also, if you want to get it without the trivia hot seat, which I do not recommend, but you actually can get it online through the website. And all of these have great quotes about crisis. Okay. Actually, I think we should, today the trivia hot seat is a little different. We, in the audience, are actually on the trivia hot seat. So maybe you should reach out to Karen and say you actually did trivia hot seat, so she'll get you a t-shirt. But today we don't have a person, so we are, who's going to be sitting on the seat. So we as the audience are going to sit on this seat together. The question is, the Ad Council just announced a $65 million multi-year mental health initiative spurred by the Huntsman Mental Health Institute. Their coalition-based and multi-audience model is the key to their success. So the Ad Council has been around for a long time. They've done a lot of work around using media to drive social change. So which of the following groundbreaking campaigns was not from the Ad Council? Was it A, Smokey's wildfire prevention, B, actor Iron Eyes Cody pollution prevention, C, crash test dummies seatbelt usage, or D, Rosie the Riveter women in war jobs? So you should see something pop up on your screen and then vote for which one you think it was not. And as soon as we get the results back, we will see if we collectively as an audience have won or collectively have lost. Either way, we're going to win or we're going to go down together, and I kind of like it. Ooh, David, I see that you've got a question here. What does Chelsea think? Do I have a Chelsea in the audience who would be Chelsea Booth? Do you want to say what you think? Oh, t-shirt if you jump in. You know you got to jump in. Okay, Chelsea said B. Chelsea said B. All right, can we sing? All right, 4% of us thought Smokey, 30% of us thought actor Iron Eyes, 9% crash test dummies, and 58% said Rosie the Riveter. Let us see how we did. All right, I knew this, guys. I'm sorry, I had pre-warning, but it was a trick question. We went down together. All of these are from the Ad Council. They also did a Mind is a Terrible Thing to Waste, Fight Polio during the March of Dimes, Just Say No, Michelle Obama's Let's Move. So what I got a little bit of background on this, and when the team was trying to pull this together, they went to try to find a campaign that was a big kind of public service campaign that the Ad Council hadn't been involved in, and they actually couldn't do it. So Ad Council's influence is broad and wide, and so it's going to be really exciting to hear from Charysse today on that. So even though we all lost, I think we all won because we learned something, and that is the most important thing. So now what I'd like to do is call up Charysse Nunez for our feature presentation. And Charysse, I know you're going to be talking with us about some of the research that the Ad Council has been doing to understand the mental health segmentation and how that's going to be informing this ongoing multi-year initiative.
Thank you so much, Aisha, and thank you all for having me today and the opportunity to share with you some of the work that has been underway to help us frame how do we effectively support the very dire situation that we're facing in our country today as it relates to mental health. So as already mentioned, the Ad Council has, we have had a long-standing focus and priority on mental health. And the vast majority of our work over the past few years has been focused on young adults, teens, and we've also had work dedicated to the veterans crisis prevention. As mentioned, we now have a very concerted effort to move forward with a new national campaign that is expected to launch in September of 2023 to reach adults, in particularly men and men within the multicultural communities specifically. So with that as a backdrop, what we did, we felt the need that it was important for us to make sure we understood the voice of the people, the American people. And what I'm going to share with you today is sourced from a large-scale quantitative survey conducted among U.S. residents aged 16 to 65. And we were particularly keen to understand the factors that hinder people who are suffering from seeking support, as well as to gain a better understanding of the segments of the population that are in greatest need. So on the next slide, broadly, as everyone here would expect, not surprisingly, general awareness and importance of mental health has gained significant and positive momentum. The vast majority of Americans, that's 8 in 10, agree that mental health is in fact an important topic. And we see approximately 70% agree it is important to have someone to talk to. And while there remains varying degrees of understanding and knowledge about mental health, we are also seeing that how people define mental health is beyond just severe illness and disorders. So with some of the work that we've done, we've asked respondents how they define mental health, and respondents shares that mental health is the ability of a person to think and reflect on their emotions, or it could be how people are actively working to address psychological issues in a healthy way. On the next slide, we see that about 50% of the population report having a mental health condition. So we know that these, the figures and the stats today are staggering, but despite the heightened awareness and the importance, less than half of those that indicate they have a mental health condition are actually engaged in getting help or treatment for their mental health conditions. And obviously the next question is why, and what can we do to support and help? So we'll go into that in greater detail, but at a high level, some of the factors that hinder those in need really center on, they vary depending on the population. And again, we'll touch upon that as we go through the presentation. The segmentation study that we conducted uncovered 6 distinct segments, and these segments cluster on the basis of personal experience with the mental health condition, their feelings about their mental health status, beliefs, and barriers to help-seeking behavior. And when you look across this continuum, you see segments that are denoted in red or orange have higher reported mental health conditions. So this is really about 55% of the population, okay, have higher reported mental health conditions. They also have notable barriers to help-seeking behavior, whereas those segments that are noted in green or in yellow have low to no mental health conditions. They report that they're gliding or thriving as it relates to their mental health status, and they're obviously much more inclined to have conversation if they are experiencing any mental health concerns. So we've also wanted to make sure that we had a clear understanding of which segments of the population, what are the mental health conditions that are being experienced? Are they highly concentrated among various segments of the population? And what are those conditions? And as you can see, those segments that are more denoted in the red, so that would be, we've actually assigned names so that we can more effectively refer to them and understand their profiles. So you see the crisis crew, and those that are reportedly in the down and dug in segment, very high reported mental health conditions, anxiety, depression, and a wide array of other conditions that are being experienced. So it's highly concentrated in about 40% of the population. But what you do see is anxiety and depression disorder are prevalent across all segments. So the next question that we wanted to get an understanding of is, while you may be experiencing a mental health condition, how would you describe your mental health status? And we looked at it along a battery of either thriving, on the most positive end, to being in crisis. And what you can see is that the segments On the far right of the spectrum, they are reportedly thriving, they're gliding through life. Yes, they have fewer mental health conditions, but for those that may be experiencing anxiety and depression, they are able to manage it more effectively. You then have those on the far left, the crisis corner, the down and dug in. Again, that's 40% of the population. They are more inclined to describe their current state as either struggling or in crisis. And then you have a sizable percent of the population that are saying they're just surviving, that they're just holding on in life and with their ability to manage their mental health status. So this is an eye chart, and I should also have prefaced that, you know, this is a 10-minute presentation. We've had to distill 500 pages down to 10, so there's a lot of information to digest here. But what we've also wanted to understand is what are some of the drivers and the barriers to help-seeking behavior, as I mentioned. And what we found is that the inability to cope with stress in a healthy way, knowing when to seek for help, and the tendency to suppress rather than address negative emotions are core challenges, particularly for those first three segments. And again, those first three segments, they account for 55% of the population. So the way to read this chart, if you look on the left-hand side, there's a battery of mental health attitudes. And the first attitude is, I'm able to cope with stress in a healthy way. And we ask respondents on a scale of agreement, whether they agree completely or somewhat or not at all. And what you can see is those first three segments, that's 55% of the population, are more inclined to say they have they're not in agreement that they are able to cope with stress in a healthy way. The next is, it's hard for them to determine when they need help. So at what point in their experience should they be reaching out? The vast majority, 65% or 47 to 65% of those first three segments are saying they're not certain. At what point do they reach out? They are more inclined, again, to, when negative emotions come up, they try to ignore them. So the concept of suppressing avoidance is very prevalent among those first three segments. And then understanding is, you know, the extent to which these segments feel it's important to actively take care, to actively prioritize their mental health. And you can see in particular the down and dug in, which represents the largest segment at 28%. That's that orange data point. 58% say that they're only 58% agree that it's important, where you have 98% of teen positivity, that 11% saying. So we know that there's huge opportunities to help support how they cope, help provide information and support on when to seek help, and to encourage conversation rather than avoidance with these segments. So we also wanted to take a deeper look at the down and dug in segment, since we know they are more inclined to state that it's not a priority. There's a lot more information behind what we're sharing today around some other struggles. Obviously, there's financial struggles, there's relational struggles that also compound the issues and impact mental health. But we wanted to take a closer look specifically at down and dug in. And what we're finding is that they're more inclined to believe that they can will their way through. So they're more apt to say, I'm more comfortable managing it independently. I can figure this out on my own. And while there is merit in that, clearly there's still opportunity because they're struggling severely. And they're also more inclined to say that reaching out for help is a sign of weakness. So that's a foundational value and belief that this segment has that clearly needs to be addressed. So again, a lot of data here. I would focus you on the orange bar, and that's the down and dug in segment. And you can see that again, on the scale of agreement, they're less inclined to say that seeking for help is a sign of strength. more apt to say that they can will through their struggles. They're more inclined to say that showing emotions is a feminine trait. So there's this underlying stigma that sharing and exposing what they're going through is just not, it's not supporting strength, okay? So these are areas of opportunities and underlying factors that drive their behavior and hinder them from getting the support that they need. We then went on to say, okay, we have to have a very solid understanding as to the who. What are the demographic profiles as we look across each of these segments? The first segment, which represents 12% of the population, they are really in crisis. As you saw, they have a wider range of mental health conditions, and again, indicate that they are in crisis when it comes to their mental health status. This group, they are more likely to be younger, Gen Z, more likely to be female, to be a part of the LGBTQ community. This is not a multicultural audience, and they are more likely to reside within the rural community. When we look at the Down and Dug In segment, you see that this is also a very young population, more likely to be Gen Z, millennials, higher representation of male, also high representation of LGBTQ community, and this is very much the multicultural audience. So they over-index in Hispanic, Black, and Asian American populations, and more likely to reside within the urban community. And then the silent but solo segment. This segment kind of straddles two ends of the spectrum, so they're not they under-index as millennials. They're either quite young or they're more on the older age spectrum. No particular skew from a gender perspective. This is the Asian American population. They over-index in that ethnicity, and they're more likely to be born outside of the US or first-generation American, and less likely to reside in the urban community. So this was very important for us. I mean, obviously understanding what the attitudes are, the underlying beliefs, but also making sure we have a clear understanding of the who as we're framing out our messaging and our plans at the Ad Council for these respective targets. Okay. On the next slide, I think we now go into what are the top 10 barriers. So really getting behind the veil a bit to understand, again, what are the barriers to talking to others? In some of the work that we've done historically, we've been wanting to encourage people to talk, but the question is, there is a valid reason for these respective groups as to why they don't do it. So what are those reasons? For the crisis crew, and even for the silent but solo, many assert that they don't want to feel, they don't want to be a burden to others. So whatever the environment is, the relationships they have, the responsibilities they have, they feel strongly that sharing the concerns that they have and the issues they have is going to be a heavy burden. So that keeps them reticent. You then see quite a few responses at high levels around many will not understand the struggle. They may not want to hear and be responsive, or the stigma associated with being judged unfairly, and they're having negative experience in the past. So I may have had conversations with professionals or with others, and the response has been negative, and therefore now I have no interest in doing it because it has not been beneficial, and it may even exacerbate the situation. You also see, which we would expect, the cost, there being a cost, the concern around the cost for reaching out for a professional, or the concern that the professional won't meet the need, won't be relevant to understand their needs and the cultural nuances of the particular audience. And then you have the last, which is around the discomfort, the stigma associated with feeling ashamed or embarrassed, and again, just being uncomfortable talking about it. So these are really, very clear areas that give us the understanding of the why. And I think for all of those that are on the ground in the community, could really help support addressing these as people are reaching out to get support. We also wanted to understand who are the trusted advisors when it comes to mental health and well-being. Who are they most inclined to reach out to? Sorry, one moment, I just need to move this so I can see this better. And what we see that the top 5 trusted advisors, there's pretty much consistency when it comes to the top 5. So you will see across all mental health professionals and organizations at varying levels. You will see family and friends, healthcare providers, and online sources. Where the distinction comes in, which is quite interesting, and I'm going to focus on the down and dug in, that's the center, that's that 28% of the population. They are more inclined to say community, community, community. So you see community at 41%, they over-index with really wanting community-based facilities, organizations to help support them. You don't see that surface to the same degree for the crisis crew or for the silent but solo. So that was interesting learning for us. And if you even drill down more for that 28%, you see faith leaders and religious groups, and then teachers and schools, etc. What you do see at the bottom is celebrities. I know we tend to leverage that quite a bit. That's not negating it, but we see the hierarchy here, and that certainly needs to be taken into account. And then lastly, you know, and again, 10-page distill down from 500, but at a high level, there is an opportunity, as what we've noted, to really support 55% of the population that's in crisis, struggling or surviving. The work that we're doing now is continuing to advance normalization and helping to elevate a reprioritizing of mental health. So the conversations about mental health, we want to normalize it, we want to help to prioritize it, and we want to reinforce that reaching out for help is a sign of strength. So we're doing a lot of work to see how our messaging can help elevate that concept. Educating again on the importance of prioritizing mental health and knowing the signs and symptoms to recognize when support is needed, and then ultimately to empower, instill a sense of hope for these communities and these audiences through connecting with peer groups, community organizations, and trusted resources that are tailored for their mental health needs. So I'll turn it back over to Aisha, and happy to answer any questions.
Thank you so much, Charysse. That was so fantastic. And you actually did get a number of really important questions in the chat. I'll bring on our roundtable first, but if there's time, I'd like to go through some of those questions for sure. But one question that I did want to raise is, if people want to learn more, is there, there was a question about whether there's the full report, the methodology, crosstabs available. Are there any other resources to learn more about the study?
There is a full report at the Ad Council. So you will, I would say, David is quite, he's on the cutting edge here, I would say, in terms of getting a preview of this information. We really were not quite ready for prime time with socialization of this. The Ad Council is going to have a concerted socialization effort in January of next year. So we will make sure that everyone has that available. And at that point in Q1, we will have the actual data available for mass distribution. So I will make sure that I share that date with Aisha and David so that you have that, and you can share that with the attendees here.
Thank you so much, Charysse. We'll definitely sit tight, and we're so excited that we got that preview. You know, thanks to David for roping you in on the early side. And so I'm gonna go ahead and bring up our roundtable discussions. And like I said, if we have time, I'll also flag some of those questions. But Charysse, if not, those questions are in the chat, and you can respond there as well. But I'm really excited to be able to bring up Tanja Miles, who is an ordained minister, author, activist, veteran and peer leader, has done such incredible work to drive really important improvements in how we address mental health and trauma in this country, including being featured in the 2003 State of the Union Address. And I'm also excited to then turn to Dr. John Draper, who's the president of research and development at Behavioral Health Link. Tanja, can I just ask you first for your reflections on what you just heard?
Yeah, so, I'm just totally blown away about, this data. First of all, shout out to all the veterans who are on the call. Happy early Veterans Day. Thank you for your service. But, being a military girl, I was always told you can't manage what you can't measure. And data is real, credible data. And the data that we heard and just now and a couple of weeks ago in Utah was so impressive. And it just really sparked a fire in all of us. Why? Because we know that from the things that we do every day, that the data is clear, but we know that data has to be given by credible organizations because we know with data comes dollars, and that's just being real. But, the fact that the information that they have, and I'm looking at it from a, lived experience and also from being a person in the community, it's so true. And even that those demographics of people that she talked about, that's really how they're feeling. And so the fact that we get to now hear this and create messaging and spaces for places is a game changer, particularly when we're talking 988 and in this crisis world that we're in. Credible data. Guys, this is not just a moment. This is really a movement happening now. And I'll end with this. Charysse talked a lot about opportunity. She said something in one of her slides about mental health landscape opportunity. She ended it with opportunity. And as she was talking about that word, I just had a conversation last night with Dan Gillison, the CEO of NAMI National. And one thing he told me that sparked me, that encouraged me more than anything. And we were talking about these different opportunities and things that are happening in this space. And he said something like this. He said, Tanja, these are not just opportunities for us, but it's also obligations for us. And so basically, I can drop the mic on that. That was a word in itself. And what was presented today leads to that.
Tanja, thank you so much. As always, you always drop the mic when you're talking. I'm gonna probably steal from you. This is not a moment, this is a movement, and I'm gonna steal from Dan. This is not an opportunity, this is an obligation. So thank you. Dr. Don Draper, can I ask for your reflections on this?
Oh, sure. And Tanja, it's great to see you. And again, here you dropped the mic. There were several times that happened when we were in Utah. And it's always such a pleasure and so powerful to hear you talk and speak about such important matters. And Charysse, your data just as moving and as powerful now to look at as it was when you first presented it to a pretty large group in Utah. There was, over, I think, 100 organizations there from all around the country, a really diverse group. And, one person noted there what our mission with this anti-stigma challenge is. And she encapsulated it by just saying, stigma kills. And as I thought about that, when she said it, I said, yeah, that is true. Deaths of despair on the rise, suicides and drug overdoses, and how stigma feeds deaths of despair is through a steady diet of feeling cast out, like you don't belong, feeling hopeless and helpless, and that seeking help won't be useful because you won't be understood, you'll be judged, it's a sign of weakness, you're burdening others, or if you can't fix the problem, no one can. And that was really highlighted in this data that Ad Council noted here. There's just all those psychological barriers just staring us in the face with that data. And I was really glad, Charysse, that you focused a lot on the down and dug in group, because that to your point, that is where you see a lot of those psychological barriers, those attitudinal barriers just staring us in the face. And interestingly, that group was prominently male, and as you noted, mostly Black, Hispanic, Asian American, Pacific Islander, and a lot of LGBTQ plus representation across all those groups. And there was one participant at the conference from organization called Black Girls Smile from Atlanta that made a suggestion that I thought made a whole lot of sense. That the campaign should begin with focusing on historically marginalized groups, because models developed by working with these populations are going to be really useful for tailoring messages to all other groups where thwarted belongingness, being cast out, feeling hopeless and helplessness are at the center of the problem. So there are some real key takeaways from this presentation and the entire gathering for me in terms of thinking about how a campaign might proceed, that the campaign really needs to be about propagating hope and promoting help, and help in different flavors. As you were noting, the down and dug in folks, they're not likely to go see a mental health professional. So, leveraging the community and how we can show models that demonstrate how people can help each other. There's some great work that Ad Council highlighted at the conference that the JED Foundation and AFSP are doing around Seize the Awkward. It's similar to what Lifeline has been doing with BeTheOne2.com, which is, how can we get people to help each other? So there's not just access to care, but access to caring, and making that as immediate as possible. And the other thing about hope, which I think is very important, is that telling those stories of hope and recovery and healing through moments of suicidality where you just think there's just no hope at all, but people getting to that other side. Evidence has shown that when people are exposed to those stories of hope and healing and they're at risk, it reduces their risk of suicide. It actually reduces suicides. And so when we talk about obligation, if in fact we know that providing stories of hope and recovery can save people's lives, then we have an obligation to put those out there. So these are the stories of hope and healing and help, and a different type of help, I think is really important for us to take away for an anti-stigma campaign. And thanks again, Charysse, for all the amazing work that you're doing at Ad Council, because they're connecting the dots. They did, all that stuff with the JED Foundation, AFSP, veterans, and now with 988. If we can bring all those together and make them all sing to each other, that would be great.
Thank you, John. That was fantastic. I really love your point also about making sure that about thinking about how to build the messaging and the focus so that it reaches marginalized communities that have not been reached before, and how that will reach everyone even better. We build this for people who it doesn't work well for, and it works well best for all of us. You had your own drop the mic moments with propagate hope and promote help, and a few others. So thank you so much, John. Charysse, thank you so much for coming to give us that preview of the Ad Council data. I know everyone's going to be really excited to see in January when we get even more information. Unfortunately, I have to keep this moving so we get to everything, but I saw a few that you're answering some of the questions in the chat. So thank you for doing that. I think there were a few others as well. Thank you. Next, I'd like to bring up Stephanie Hepburn, who is the person who does the crisis talk articles, and typically in this segment would be interviewing the person that she interviewed for the most recent article. But the most recent article was actually Stephanie writing about her own reflections on reviewing the first 200 articles in Crisis Talk. So Stephanie, you kind of interviewed yourself, so I'm going to interview you.
Thank you.
So, so you sat down, you read those first 200 articles. Tell me what you saw in terms of where we've been in terms of building a crisis system, and where it tells you about where you think we're going to be going.
So when I started, David hired me to develop Crisis Talk, and the idea of it was an ongoing conversation. When at that time, there was no COVID, there was no 988, though it was, around the corner. And so I had no idea what I was in for. And so it's been just a monumental experience to talk to you. I interviewed you and others, experts. And when I say experts, I mean lived lens as well, to share their experiences in terms of navigating the crisis system, which to me is one of the most vital and critical pieces. But, you know, like you and like everybody else on this call, I navigated COVID as well. So I talk a little bit about that article and what I saw within my own community and talking to experts to see, you know, so it wasn't myopic, what was happening nationally and internationally. And so it's been just a tremendous experience for me. But I also want to make sure that there's a pressure on sustainability. What happens next? So I worry, you know, we have 988 and I've talked to these groups that have these fantastic innovations, but interconnection is still not there. We're still not well enough connected with our 911 systems to divert to 988. So, you know, keeping that pressure there is really what I want to focus on. And also on sustainability, what's going to happen? What about reimbursement? Is this something that we're just scaffolding systems, but they'll end up being shells of what they could be because there was not enough sustainable funding. So I also want to use this as an opportunity to put a call out there to people who are listening. If you have some innovative billing, if you're, you know, I've heard of a program and that will be in a forthcoming article where they actually bill retrospectively annually, but it goes to commercial and Medicaid and Medicare and insurers to see, you know, hey, this is the percentage that you're responsible for, and that's how they're doing billing. So I want to figure out the sustainability aspect and bring those conversations. We are still dealing with the same issues that we were before July 16th. But I also want to put a lens on what's happening next.
That's fantastic, Stephanie. You've had a really wonderful perch to see the system go from sort of pre-988, planning for 988, now post-launch. It's so exciting to hear about where you're thinking this series will focus in the future. Keeping you know, in line with the theme of hope that I've been hearing today.
Yeah.
Can you talk a little bit about what you read in those 200 articles that made you kind of hopeful about where the crisis system is going and people's vision for that?
So, you know, when we were, you know, in the presentation and the feedback afterwards, I think when I hear about barriers, you know, it's so multi-layered. Sometimes there are barriers within our own cultures that make it harder to reach out, but there also have been, you know, barriers within the system. And so looking at, you know, the 200 articles that I've done, again, there's sometimes really fantastic, innovative programs, but they're not connecting to other behavioral health services. So we have disconnects within our own systems, and then again with 911 and law enforcement. And when somebody has a bad experience, they're less apt to want to navigate that again. And so part of it, when we talk about hope, I mean, I think the challenges of hope is there are ways to measure hope, but for a lot of people, especially with lived experience, it can be really annoying actually to hear the word hope, because that feels like tell me really, how can I get there? Not don't create this like or this sense of how I should feel. Tell me, what can I do tangibly to feel better? So I think there's this kind of disconnect between what I'm hearing for people with lived experience navigating the system. And I mean people like themselves, kids, adults, family members navigating the system, and hearing this word over and over again. I know where it's coming from. It's so well intended, but I think making sure there's not a disconnect there between what we're trying to say versus how people are hearing it. There needs to be a lot of people at the table from leadership all throughout systems that have lived experience.
Thank you, Stephanie. I think that's a really important point. You're keeping our feet to the fire on the ways in which we continue to need to drive towards making sure our systems do work for people, that they are connected, that they are effective, that they actually meet people where they're at. And if we miss those opportunities to support people in the moments when they're in the most pain, we may never, ever get that opportunity again. And so while we're holding that space of like, we're making progress, we have to recognize that we are really still not doing enough. And so I really think that that's an important message to be able to hear. And I just want to thank you so much for doing this work. Your articles are deeply illuminating and touch on so many of the important issues we're all trying to tackle. And so I'm super excited to see the next 200. Thank
Thanks,
you.
Aisha. Thank you.
Speaking of getting into people's experience and more deeply getting into it, one of the other themes that the Crisis Jam has been talking about is really understanding both the lived experience of people who are in crisis, who've experienced crisis, but also the lived experience of people who are in the systems that respond to people in crisis and support people in crisis. So one thing that the Crisis Jam team is encouraging people to do is to go on a police ride-along and then to reach back out and let us know what you experienced and what that was like for you. And this slide gives you a little bit of an information about contacting your local law enforcement agency to see if they offer them and see what kind of what the requirements are for you to participate. And then if you do go on it, please reach out to Karen and let her know what you've experienced. It's an important and interesting opportunity to be able to see how one segment of the system experiences and responds to people in real need. So next, we're getting into the space where we're going to be hearing some lightning round updates from some of our partners on this. So can I call up James Wright to give us the update from SAMHSA?
Sure. Good morning or afternoon, depending upon where you are. And also, I'd like to extend an early Happy Veterans Day as well for all those that have served or are living with people that have served. So thank you. A few quick things. I wanted to share that SAMHSA has been able, through the Safer Community funding, to extend out support to states and territories and our network administration for a number of activities that are going to be really crucial as we look forward in fiscal year 23. One of them we've gotten a lot of questions around, which is communication and marketing. And so we're pleased to say that the vast majority of all those that had received the state and territory funding also have received or are in the process of receiving supplement funding. And one of those activities is really going to be to develop and enact a communications and marketing strategy of 988 Lifeline in conjunction with SAMHSA and HHS's communication and marketing strategy as well. And so we're super excited to see that build out over this year and start hopefully getting access to those individuals that otherwise are not aware of 988 services. I also wanted to highlight that we just closed and are working through the process for the 988 tribal program that was offered, also part of our Safer Communities funding. And then finally, I do like to provide an update of services when we are positively seeing impact. And I am excited that as of November 1st, we were able to bring in a couple more centers to help respond to our Spanish demand, really trying to make sure that we can increase this service to this critical population. Those started effective November 1st, and we're excited to bring on Beacon and Linnea Paz from Puerto Rico as part of the centers helping support that. And I'll finally highlight two additional services we're really targeting for fiscal year 23 and not all encompassing, but two that are specifically going to try to be expanded quickly are services in Spanish for chat and text, and our services, video phone-based services for deaf and hard of hearing. So we'll be working very closely with centers and the network administrator to make sure we can continue expanding 988 reach. So thank you. And that's it from SAMHSA.
Thank you so much for that update. I'm going to bring up Dr. Brian Hepburn for the NASHFIT update.
Thank you, Aisha, and thanks for continuing to do a great job as always. Sometimes it's tough, you know, being in that seat that you're in, but you do it very well. Thank you to James and the leadership of SAMHSA. A lot of really impressive things coming out of SAMHSA, and want to thank David Covington and the RI group that do such a good job week in and week out with this jam. I briefly just wanted to address the fact that SAMHSA will be coming out either tomorrow or later on this week or Monday with the SAMHSA national guidelines on youth crisis care. This is something that we've all been hoping will happen soon, and we've heard really good things about it. And so we're excited that this release is going to happen soon. Also, simultaneously with that, the NASHPD Child Crisis Paper will be released. It's called A Safe Place to Be, Crisis Stabilization Services and Other Supports for Children and Youth. And we think that that paper, along with the SAMHSA National Guidelines, will really help to emphasize the importance of 988 and crisis services for young people, and give the states, all of the people on the call, the providers, all stakeholders, really a nice playbook for youth crisis care. Also want to point out that the NASHPD paper is one of 10 papers that will be released next week as part of a compendium from crisis to care, which, as I said, includes the child crisis paper. So we think that these will be really good additions to the material that's out there. And we look forward to that happening, to the release by SAMHSA. And hopefully you can all get a hold of those resources and benefit from them. So thank you.
Thanks so much, Brian. I'm excited to see those. I know our team's going to be pushing those out and reading them ourselves. So thank you as always for putting out really helpful and important materials. Next, I'd like to bring up Dr. Ursula Whitehead. She is the CEO of Now. Oh my gosh, Ursula, I'm so sorry. I just had your Now Makes Now, as well as a clinical psychologist and researcher. And Ursula, I'm so excited to talk to you in this lived lens segment, which, as you know, this here is a picture of base camp and then the trail up through the mountain, and thinking about if we're at base camp of where we want, of where crisis systems are operating, and if we want them to get to that zenith of being systems that really support people in the way that they need support and that are effective and compassionate, like what does that look like? So I'd love to hear from you and from your experience, what you see as the vision of the top of that mountain.
Yeah, thank you so much. I think I want to start by asking this question of you, of the difference of what it's like to be asked the question of, are you still having suicidal thoughts versus do you have the tools to manage suicidal thoughts that arise for you? Two related but very different questions that have to do with recovery. So my hello is from the state of Washington. I'm out here and I did most of my training with a woman named Marsha Linehan, who developed dialectical behavior therapy. So we were sitting in rooms with people who wanted their lives to end. And at the time when I was working with her, she wasn't open about her lived experience. That came later, but out of the experience of working with her, I created a team of people with lived experience who wanted to share their experiences and tell their stories. And I figured I probably should too, if I'm, supporting other people to do this. And, in the process of gathering information, doing qualitative interviews and studies with people with lived experience, and just my own team Now Matters Now, I found that, there's this theme that arose that fits with the theme of today, which is, above all, people in suicidal crisis need three things. And that is that we do not panic, that we are present with them, and that we offer some type of hope. And that hope part is the thing that is in so many ways so complicated. We know what bad hope offering looks like, but it's hard to train. But good hope offering looks like seeing something about a person, seeing some part of strength and recognizing that and sharing that back to them. But it also might mean more practical, saying, some of the things that people have been through that are similar to yours, they've found some resources that can be helpful. And I'd like to share them with you. I'd be happy to teach you some of those things. So I really genuinely believe there's a future where we train our crisis line workers, our crisis staff, in tools for coping with really intense emotions. We teach them to use them in their own life. And then as part of that, we also teach them how to teach them to other people. So that if somebody chooses, if they want, they can learn a coping skill in the moment to apply and use in their own life. So that's really where I see things going in terms of hope of different flavors. And I'll share a little bit more information in the chat here. So thank you so much for having me.
Oh, thank you so much, Dr. Whiteside. I mean, I just wrote down, it really hit me when you said we do not panic, we are present, we offer real hope.
Yeah.
And that distilled for me in a way the what is necessary when you're meeting someone in a difficult time. And I really love that vision. And please do offer some resources in the chat and some additional information. I think the team here will be really excited to see those. So thank you so much for your time, and more importantly, thank you for your work and for sharing your story.
Likewise, thank you guys.
Absolutely. So now I'm going to be turning to our federal update. I think that I do have with me Sarah and Joanna, or Sarah, I think you're the one that's giving it today, right? So Sarah, please.
Thank you, Aisha. So yesterday were the midterm elections. They are still counting votes for a number of House and Senate races. So it seems like it will be a little while longer before we get more information about the makeup of Congress and the final numbers for the next Congress. It does look like the Georgia Senate race is going to a runoff election in early December, so it could take up until December theoretically, but we will see on that. On the Senate finance process that I mentioned last week in the bottom corner here, the crisis draft will be released either later this week or early next week. That is a part of the mental health process that the Finance Committee has been working on for over a year. And there's one remaining draft after that that we're waiting on, the parity draft. And members will be coming back into town on November 14th, so next Monday. And then they've got a couple weeks this month and a few weeks next month to figure out any sort of end of year spending package and if they are able to attach any of these mental health committee bills to that process. So we'll have lots to update on hopefully in the coming weeks, but at this point we are waiting for people to return to town in DC and figure out what they can find some agreement on before the end of the year.
Thank you so much, Sarah. It's great to have your eyes on this and giving us the download. Next, I'm going to call up, I think I have Stephanie with me today to do the state update. Stephanie.
Yeah, thanks, Aisha. And actually, I'm going to be also joined by Jordan Pantalone from Vibrant as well. But I will go through and just mention actually a territorial update. Puerto Rico has new 988 related legislation. That number is PC 1550. I'll put a link in the chat. But just real quick, what this measure does, it will set up a psychiatric emergency management program to respond to mental health emergencies. And this program is going to be responsible for creating crisis intervention teams that will specifically consist of a paramedic, a social worker, and a behavioral health specialist. The bill also clarifies that those teams can be dispatched by both 911 and 988, sets up kind of the implementation and oversight structure for the program, and mandates that there will be monthly and yearly reporting on 988 data, including demographic info of folks contacting it and response times for those crisis teams. And I know recently we had a couple hearings in a couple states related to 988, but I will let Jordan cover that.
Yeah, thank you very much, Steph. I'll keep this pretty quick. So first we had one in Wyoming about a month ago. That was before the State Revenue Committee, heard for some folks who testified in favor of a 988 fee and some broader 988 funding. The committee ultimately decided that they were going to go the trust fund route, so ultimately earmark kind of those state dollars for 988 and crisis services. There is no bill there yet that exists, but we're hopeful in the next couple of weeks we'll see one pop up. And second, just very quickly, North Dakota, kind of a similar situation, had some folks testify before the Health and Human Services Committee in support of a 988 fee. No bill yet, but we're hoping as things kind of settle down after the election, we'll kind of have some more intel there. And of course, we will share that when we have more information. That's all I have. Back to you, Aisha.
Thank you so much, Stephanie. And thanks, Jordan. Sorry for not remembering to call you up, but that's super helpful. We've got the Moving America Soul and Suicide official trailer coming out. I believe we have a link to it that will go into the chat. And then I'm bringing you all home. Next up, we have Dr. John Walkup and Raul Botello talking about healing through justice. And then we're gonna make sure to pay attention to the holiday schedule because we closed a few times in November and for Christmas. And happy early Veterans Day. Thank you to everyone who has served. And we will see you here next week at 12 noon Eastern time. Take care, everyone.